My name's Paul Aringo Gwada, and we are in Mbakasi. I used to live my normal life. You smoke, mirror, what have you, discos. And then I started being sick, on and off.
Akaniambia nafaa kumpeleka hospitali. Nikasema in case Paul apatikane positive. Si hata mimi pia tu niko positive.
The two have lived with HIV for 7 years now. What would have been considered a miracle before Kenya had access to ARVs.
2007 I lost an uncle. Angezajua status yake mapema. I initiated into ARVs and survive. If it was not for ARVs, maybe hata mimi ningekuwa the same line my uncle alipass.
Akaanza kugain weight, akakuwa tule Paul mimi najua.
Because of the life-saving drugs, Paul and his wife have been able to care for their family and continue to live a normal life.
Tunakumbushana watu wetu pia kijua saa mbili. Baba saa mbili, mama saa mbili.
Iko kwa mind yangu ati niko positive.
They are among 450,000 patients currently on anti-retroviral treatment in Kenya. Apart from the individual benefits of anti-retroviral treatment, the National AIDS and STI Control Program says putting HIV patients on ARVs when the CD4 count is still high has a huge economic impact on the country. A study carried out on a tea farm in Kericho, whose results were published in the Kenya AIDS Epidemic Update 2012, indicates that ARV treatment enhanced productivity among HIV-positive workers. After getting the treatment for just 9 months, the workers' productivity rose by about 20% and they worked 7 hours more per week. A strong pointer to the financial benefits of providing ARV treatment to more Kenyans living with HIV. Another study conducted by the National AIDS and STIs Control Program, NASCOP, indicates that for every 100,000 patients put on ARVs at the recommended CD4 count of 350, over 230 deaths will be averted. 500 children are saved from being orphaned and 6,000 new infections are averted. A similar study was conducted in Swaziland last year, which predicted that if the country moved forward to extend universal access to ARVs, deaths from HIV-related illnesses would be reduced from 25 to about 14%. A further study by NASCOP and the Center for Disease Control estimates that if Kenya maintains the current pace of providing treatment and care, the cost of treatment will go up from about 30 to 55 billion shillings by the year 2020. That is just 6 years from now. This is money enough to drill 760 boreholes in each of the 47 counties. This huge investment in HIV treatment is, however, expected to stabilize and remain static in the years to come.
Ningejua status yangu mapema, at least maybe singeingia hata into ARVs. Ungekuwa na advantage, ningekuwa kwa prophylaxis, septin peke yake. And maybe pia singepata hiyo challenge ya kufight, ni fight to uplift my CD4 count. Ndio ninge into ARVs. Because the minute nilikuwa initiated into dawa za TB, I had to fight a fight ni increase my CD4 count, of which it was 50-50. Because a CD4 count of 5, no kona TB.
The World Health Organization WHO recently recommended that people living with HIV start their treatment earlier, moving the treatment threshold from 350 to 500 CD4 count as a way of intensifying the response towards HIV. This move would make not just public health sense, but also economic sense. So far, not many countries in sub-Saharan Africa have managed to provide universal access to its citizens, which could end the epidemic.
ARVs for me is a help. We gave birth to a beautiful baby girl. Alikuwa HIV negative, nazenda job na train, na nalinda pia toi, na bado nataka kuona mpaka wajukuu.
Violet OTINDO, K24 for Health Unlimited.